back. We're about to start our next session here where we're going to explore non-game applications for virtual reality. And we're going to start things off with Dr. Sonya Kim from One Caring Team, right? Welcome, Sonya.
Thanks, Carl. Good morning, everyone. Good to see you. One Caring Team. We use VR to lift spirits of seniors who are isolated and lonely. And some of them, and many of them, have dementia and suffer from all kinds of chronic complex care conditions. So I want to share a couple of stories with you. I got a call one day to take care of Betty. Betty is an 88-year-old lady who lives in assisted living. She stopped eating and drinking water because she felt that she didn't matter anymore. So she ended up in the emergency room 3 times in 1 month and got admitted to the hospital twice, all in 1 month. And her medical bill was $56,000. So I asked Betty, why did you stop eating and drinking water? And she said to me, Dr. Kim, I don't matter anymore. No one loves me. No one cares about me. Why should I eat? Why should I drink? Why should I live? Can you help me die today? So as a single woman who used to work in ER and taking care of thousands of patients like Betty, coming in with dehydration and malnutrition and electrolyte imbalances, I decided to do something about it. So that's how I found One Caring Team. So did you know there are 44 million seniors in the US today? And it's a growing problem. That number is going to double next 25 years. And social isolation is costing us $100 billion a year because of frequent ER visits that's avoidable and preventable hospital readmissions that's costing us $17 billion a year. Depression, anxiety is on the rise. America simply doesn't know what to do with lonely seniors. We need to do something about it. So 103-year-old Virginia, she feels alone. Even if she has a daughter who comes by, visit her every other day, she still feels empty because all of her friends died. Her husband passed away 5 years ago. And her daughter is busy with her own life. So she can't be there all the time with her mom. So she's dying inside. And we need to do something about it. So how do you transform Betty's life when she's 103? Well, we can do something about it using virtual reality. Who would have thought that emerging technology, such as virtual reality, can touch so many lives? So this is Aloha VR, and that's Virginia enjoying our scene. We're currently working with B2B accounts, long-term care facilities, assisted living with memory care units. And that's our 103-year-old Virginia enjoying our Aloha VR in her room. So she's got a mixed dementia. She's got a touch of vascular dementia on top of Alzheimer's dementia. And after she was done, okay, you can play Terry's video.
So what do you think of our mission at One Caring Team?
I like your mission. I think it's cutting edge and it's exciting. It excited my mom when she's had her 2 or 3 sessions with you. Brought a wholly new element into her life. She seemed excited about the experience after she was given the opportunity to look through these wonderful classes.
Mm-hmm.
And so I think it's brought joy to her life and made her think out of the box a little bit.
Right. So how did you get interested in our Aloha VR program in the beginning?
Well, I ran into you at a family seminar at the Coventry where you were just there as a speaker during a family night where the director was briefing the family members on what was going on at Coventry. And you had the opportunity to present your program. And I listened to your presentation and I got interested in it. So I started talking to you after the presentation and then you met my mom and here we are.
Great. What made you decide to sign up for our private Aloha VR program?
Well, I saw the images that you have in this virtual reality machine, and I thought thought it would be interesting for my mother, who had been complaining about being bored, and looking for something new in life, to the extent there is something new in life to a 3-year-old. Living in that room 24 hours a day and looking forward to the meals that sometimes she doesn't even particularly like.
Okay. So what do you think of our mission at One Caring Team?
I like your mission.
Okay, so on your right is an MRI of the brain of a patient who's in a lot of pain without VR. On your left, on your right is the person who's gone through the VR therapy, and you can see the reduction of the inflammatory changes on the MRI. So the clinical application of VR that we're using in the field today has been pioneered in the 90s. And that pioneer is in the room, in our team, Dr. Tom Furness. Thank you, Tom, for coming. He's our acting CTO. We're overseeing our technical development, R&D part. And Rosemary was our customer last year from Renal Care who wanted to join our team. So this is a huge market opportunity. There are 43 million seniors, over 11.3 million seniors live alone. 8.6 million seniors live in assisted living. Senior care is $319 billion, and it's growing. And at One Caring Team, we're interested in working with folks who are interested in non-gaming application of VR. Thank you. Yeah, sure. Okay, sure. Anybody have a question? Yeah.
What have been one of the most obvious immediate responses from your patients who've actually been using the VR?
Sorry, what is the?
What has been the most dramatic change you've seen?
Dramatic change. Oh, okay, great. I didn't bring Bob's video. So we were launching our Aloha VR program group therapy sessions at one of the memory care in San Francisco. And the caregivers, there were private caregivers and staff, and they were all watching us. And one gentleman, he's probably in his 80s, you know, he's like this in a wheelchair. All the staff told me, don't even go near him because, you know, his name is Bob, and Bob is cantankerous, very difficult. He punches people. Oh, Dr. Kim, you don't want to go near him. He punches people. And I said, it's all right. I used to work in level 1 trauma center. Critical care is my thing, so let me handle this. So after letting him watch us give Aloha VR care to other seniors, we put the goggle on him, and he absolutely loved it. And he became a completely different person. So from this anxious, fidgety person who, you know, who's about to punch you, to he became this docile, his heart rate came down, his respiration rate came down, his HRV went up with the coherence being higher. So we're measuring all these physiological changes, and just clinically speaking, I mean, I'm a clinician, so I'm watching my patients transform before our eyes. We couldn't believe the transformation that we saw. And I'm so glad you asked, because this is a classic case that we talk to our customers and potential customers about, is how would you like for me to, you know, give you a tool to take care of some of your most difficult patients? Because assisted living directors don't know what to do with them. They're paying you $15,000 a month to house Bob because he's a bit difficult at home. Nobody knows how to do with them. And when we give this Aloha VR therapy, Bob becomes more normal, or more, you know, friendly and warm and kind. And second time we went, so we had caregivers, you know, take their phone out and video all these beautiful transformations that was happening. And I asked some of the caregivers to make sure that you show this video to the family of Bob, because families, you know, Bob's family needs to know what happened today. This was a miracle. So they did. And the second time we went there for the group therapy session, the caregiver asked for my number, my contact, because the wife of the Bob apparently wanted to, you know, buy our program and everything, private sessions. So that's how we do. We have a B2B, you know, relationship with assisted living. And then when the family members want to buy the private package, then we sell the private package. So that's how. So anyway, so yeah, so that's one of the examples is, you know, I mean, it's a pure miracle. How do you turn Bob around? We did with our Aloha VR. So.
Well, why? What did he respond to?
What did he respond to?
What was the thing that?
Right. So you should talk to Bob. It's one of those drugs. You know, there are, I don't know, thousands of FDA-approved drugs that went through all the clinical trials, phase 1, 2, 3, and the exact mechanism of action, MOA we call it in biochemistry, is unknown, right? So I'm not going to sit here and make up the exact MOA for you, but what I can tell you from a clinician's point of view is that we took Bob away from brutal reality of nothingness, the emptiness, and we put him into an immersive environment that is full of, you know, beautiful things to look at, where he can forget the fact that he can't walk anymore. He can forget the fact that he can't travel anymore. He can forget the fact that he can have a conversation with you. He can forget the fact that his wife doesn't want to see him anymore. All those ugly, brutal reality, he can forget it. As soon as we put the, you know, a VR headset on, we completely transport him to a new happy place. And so there's clinical benefit, I feel, when we help them transport to a happy new place. That is what's happening. Now, how does it happen on your neurons and which synapses? I can't tell you. And if I knew, I wouldn't be here. Next.
One more question.
How responsive has like the directors of these facilities been to this kind of new tech, you know, in terms of letting you in there and actually letting you
Sure. So we have an unfair advantage at One Caring Team. I am a board-certified ER physician. I've been in healthcare for 20 years, and I've been making house calls in the Bay Area since 2009. So many of these assisted living directors know me because I was making house calls for some of their residents in the previous years. So when I go in there and say, hey, I have this new therapeutic modules that you might want to try, they're more than open to talk to me because they know that I'm not going to just give them some gimmick or anything. So I bring that scientific background and the community credibility that I already have. And most gamers don't have that. So, you know, if they try to, you know, just do what we do, they might find some, some interesting challenges in the field. Yeah.
I had a question. So a lot of the content that you're showing seems to be CG.
Uh-huh.
Are you also looking at video?
We are open to videos. We're working on some things, but once we release it, we'll let you know more.
And then the other question, do you take any feedback? So in terms of like head movement and how some of the seniors are actually interacting with the content?
Absolutely, absolutely. You should ask Tom about that. We're working with Tom's Rat Lab in Seattle, so he's teaching me all the time about technology, and I'm sharing my clinical insight with his rats at the Rat Lab. So we have a very good symbiotic relationship. Anybody else before I go?
Yep. I think we're about out of time, so thank you very much, Sonya.
Great. Thanks.